Hi, I'm Anita Parhar, and I work with parents, students, and teachers in school. This show is dedicated to those of you who are new to Canada. Each episode, we will be talking about different issues related to health, education, finance, and law. And this is my co-host.
My name is Gurdeep Parhar, and I'm a family physician. We really hope you enjoy these episodes. We also hope that with each episode, you learn some pearls that will help the lives of your family members and yourself. If you can give us some feedback on these episodes or tell us what future episodes you'd like to see, go to our webpage, www.pearlsforsuccess.com. So Anita, what are we going to talk about today?
Well, today we're going to be going to a dentist's office.
Dentist office visits can be very stressful. There's the smell. You walk in and you smell the fluoride right away. And your mouth is a personal, private space. It's not something that you want people inside of.
Oh, for sure. And for some people, it can be very scary, intrusive and going into your mouth. And I think like a lot of people associate with pain.
I know that a lot of my patients and a lot of our friends often ask about things like, how often should you be brushing your teeth?
Right.
Should you always be flossing? Should you be carrying floss in your pocket and flossing on a regular basis?
Sure.
I actually know people who do that. What kind of toothpaste do you buy? You go to the drugstore and there's this huge selection of toothpaste. Everything that'll whiten your teeth to make your breath smell better.
Right.
I think these are things that people get a little bit confused about.
Indeed, they do. I know that a lot of people also wonder when it's a good time to take, for example, children to go see a dentist. In schools that I work, I see some of the elementary school children going to the washroom to brush their teeth. And you know that they have teeth coming in and they're getting a little bit older. But a lot of kindergarten parents wonder, should the baby teeth be brushed? When do I see a dentist? When should I be taking it and what exactly should I do?
It's a bit confusing because if you think about baby teeth, they're eventually going to fall out. So should we really be taking care of them?
Right.
Or should we wait until the adult teeth come in before we see the dentist and get regular checkups? Regular checkups are another issue.
Right.
My patients are often confused. In fact, I have to remind them, when did you see the dentist? And I guess the question is, if you're not having tooth pain, if your jaw isn't hurting, if you don't have an infection, should you be seeing the dentist? These are puzzling topics that I think we would probably need more information on.
Indeed, those are very good questions. And I think we should take a look at an example after a word from our sponsor. Let's see what happens when a patient goes to the dentist's office. He has a pretty common problem, a toothache.
Hi Cam, how's it going?
I'm doing okay, just my tooth's killing me.
I'm sorry to hear that. So when did the problem start?
It's been going on for about a year or so now, and it seems to be getting really bad now.
That's a long time. Which one is it?
It's down in this area back here. I can't really tell which one it is. The whole area seems to hurt.
Okay, well I'm going to have a quick peek here. Is that keeping you up at night?
Yeah, last night I almost didn't sleep at all. It was hurting so much, that's why I decided to come in today.
Okay, here, let me have a look in your chart. Last time you came in, you had a similar problem on the other side. That was over 2 years ago.
Yeah, it's been a while since I've been in. It's just been really busy at work.
Are you brushing at home?
Yeah, I usually brush every day. Sometimes when I can't brush, I'll just use some scope and leave, but otherwise once a day.
Really? You should be brushing at least twice a day.
Yeah.
At night and in the morning. Okay, do you floss?
No. Every once in a while I'll use a toothpick to kind of clean my teeth, but no, not very often.
Okay, well we'll have to take an X-ray and see what the problem is.
Okay.
All right. Here, we'll put this on you.
Well, that visit did not seem to go very well at all.
That was a good example of a patient who rarely ever brushes his teeth. I think brushes them once, as he said, if he has time. And it sounds like he never flosses his teeth either. I can only imagine what kind of shape his teeth must be in.
Well, he doesn't seem to go to the dentist very often either.
And you see this a lot. I can see the dentist in the situation getting quite frustrated when patients are only coming when they have a problem. Really, it seems like, a lot of care should be done between dental visits. And patients should be seeing dentists just for regular maintenance. That's what I would think, being a medical doctor. But you know what I wonder? Let's go talk to an expert. We're going to talk to Dr. Stuart Katz. He's a family dentist in Burnaby. We're going to ask him if he has any tips that will help you take better care of your teeth. We're very fortunate today to have Dr. Stuart Katz, who's a very popular dentist in Burnaby, joining us so that we can get some advice on dental health care. Thank you, Dr. Katz, for joining us.
My pleasure.
Now, as a busy family dentist who sees all sorts of problems, what's some basic advice that you give your patients that they can help their teeth and the teeth of their family members?
I'd say be proactive, take control of your oral health by establishing good habits at home. One should be brushing and flossing twice a day.
Twice a day, so
Yes.
definitely
At least.
At least.
In between, if you want to brush and floss after meals, that's helpful too. But we're talking about in the morning when you wake up and before you go to bed.
Mm-hmm. I don't mean to be difficult, but if you're out and about or you're at work or at restaurants, would you expect somebody to pull out their toothbrush and say, sorry, I got to go brush my teeth?
No, unless they had braces or something, but no, I think that really what we aim for is twice a day.
Twice a day.
Yeah.
And does it matter the type of toothbrush or the toothpaste that somebody uses? I know when I go into the drugstore, the choices are overwhelming, and sometimes I don't know what I should be using.
Well, we tell everyone to use a soft toothbrush. That's pretty standard of care. You don't want to be brushing too aggressively. You could brush away your gums, so you don't want that to happen. As for toothpaste, there's a lot of them out there, and some are for sensitive teeth. Some are a bit too abrasive, like those that are aimed at, reducing stains from smoking and that sort of thing. So you should consult your dentist before choosing a toothpaste like that.
Sounds like wise advice. When there's that many choices and you don't know what to do, talk to your dentist about which one would be the best for you.
That's right.
What about flossing? I know people nag, or dentists nag about flossing all the time. Why is it important?
Flossing does, you're cleaning part of the tooth that isn't being cleaned by your toothbrush. So you're going in between the teeth. And it's also extremely important to floss if you have gum disease. This is, I'd say you're as important, if not more important, than brushing your teeth.
Sure. And how often should somebody floss?
You should floss as often as you brush your teeth. As often. I mean, every time you brush your teeth, you should floss your teeth.
Okay. Another question, this might sound strange, but people ask this often, should you brush your tongue?
Yes, it's a good question. Brushing your tongue is good hygiene. So I think, a lot of bacteria do grow on tongues and other surfaces in the mouth, aside from your teeth. So I'd say as part of a comprehensive home care program or regimen that you should brush your tongue.
Yeah.
Yeah.
And what do you think about rinsing? Is rinsing with some sort of mouthwash important as well?
I'd say in the same way as brushing your tongue, rinsing is a good adjunct and can be very helpful at home.
Sure. Now, the other question I have is, how often should somebody see their dentist? I know most of us, think about our dentist when our tooth hurts, but I'm guessing that that's not when we should be thinking of the dentist.
That's absolutely true. Depending on your oral health needs, I'd say from once a year to as often as 4 times a year. If you have gum disease, then which is particularly aggressive, then we'd like to see you every 3 months to have a cleaning done every 3 months.
Mm-hmm. So in the best case scenario, you should have a cleaning every year at least, or every 6 months?
On average,
Okay.
twice a year.
At least twice a year.
Yeah.
Okay. And when you do, just for a regular checkup, I'm just thinking about when people see their family doctor and they get blood tests done, or they go to the eye doctor and get the eyes examined. So you'd examine them and then do a cleaning. And is there anything else as part of the routine checkup?
Well, the X-rays are also important, allowing us to see in between the teeth and around the roots of the teeth. And again, it depends on your needs, but I'd say on average once every year and a half or so that we would take an X-ray.
Sure. Why, when you have a toothache, what is it that causes the tooth to be painful?
Well, there's actually many different causes of toothache, from decay to dental infections. It could be root sensitivity or a cracked tooth around an old filling. Could be that you're clenching or grinding your teeth, and that's causing them to be sensitive. So really, it does require a bit of detective work sometimes to figure out what the problem is.
Sure. If somebody, I'm just thinking, it's the weekend, Friday night, and your tooth starts hurting, and let's say, I know you're very good at being available for patients all the time, it seems like, but let's say somebody can't reach their dentist. Is there anything they can do until the dentist is available for them? Is there anything that they can try themselves at home, or is it too complicated to?
No, I think it's a good question, and a lot of dentists offer, after hours care, or at least to be available to talk to people after hours, or to direct them to some a clinic or even the emergency room at the last resort. But usually we don't really have to do that. But as a last resort, it is there. There's all-night pharmacies that we can assist people by prescribing a painkiller. But I think as a whole, dentists do make themselves pretty available for people after hours.
That's great. A lot of our viewers have small children, or they're thinking about having children. So can you give some insight into what's the youngest age that children should start coming to see the dentist? Should it be, I'll give you the scenario. People sometimes think that baby teeth aren't important because they're going to fall out anyway. And so maybe we should only see the dentist once the adult teeth start coming in. Other people say no, baby teeth are important. There's some confusion around that. Can you help us with that?
Yes, of course. The baby teeth or primary teeth are very important. They keep the space for the permanent teeth, and also decay can spread during the period of time when you have both your primary teeth and your permanent teeth. Decay can spread from your primary teeth to your permanent teeth, so it's really important to keep those primary teeth clean for that reason as well.
So what's the earliest you would normally want somebody to come in for a checkup if they didn't have a problem? What's the youngest you would see or would want to see?
Well, a lot of my patients will bring their toddlers in just to have a look, and it's a short, it's a short visit, and often it's not like sit in the chair and open your mouth, but it's an introductory to dentistry, and it's important to have that good first impression, and it's a lasting one. So. It's always a fun visit, one that I look forward to. But that's, I would say, as soon as they're walking, is probably a good time to come in and have a look.
I know you're very popular with children of all ages. Now, give us some examples of strategies you use to get kids comfortable, because it's quite a tough thing to have somebody look in your mouth.
Right. Well, one of the things we do is we have some toys available for them to play with. I wear a little hat with some images on it that
I should have had you put it on.
Yeah, I have a few of them, so sometimes they try to guess which one I'm going to wear. But having the assistants there and just making it fun for them is important. Making a joking with them and having fun with them. I think it's a real way to an icebreaker for some kids.
Sure.
Yeah.
Thank you very much. Is there anything else you want to add in terms of what you would want our viewers to know about when they come to the dentist? Anything that would make your job easier when you're helping deal with them and their families?
Well, I think it's important, if there's a language barrier, to have someone who can be there to help with the language. Often what I find is that people are a bit anxious,
Sure.
very anxious, and they like to have their family with them.
How many family members should they bring?
Well, they should have someone to help them with interpretation, and I don't mind if there's another person in the room too to help them, just to get, to help them, to offer them some support. So, but I think once you get more than, 3 people in a room, it does become a bit crowded.
Sure.
So I would try to limit that number to 3.
Great. Thank you.
Yeah.
Thank you very much. All the pearls that you've given us will certainly help people when they're seeing the dentist and improving their oral health care.
Thank you. Thank you for having me.
Dr. Katz gave us some really good tips, some pearls. Let's see what happens when we take those pearls, those tips, and put them into practice. So the same patient is going to go see the dentist, and let's see how things can go a lot better.
Hi Cam, how's it going?
I'm good, Dr. Katz. How are you?
Good, thanks. So what seems to be the problem?
I woke up this morning and I had a little bit of pain in one of my molars back here after I had something cold to eat for breakfast.
Okay. All right. Here, let me have a quick look at that.
Yep.
I don't see any obvious problems. Your teeth are very clean. Your gums look healthy. Let me have a little look in your chart here. I see in your records here that you have had a cleaning and x-rays taken in your last 6 months. That's good. How about those mints? Are you still eating a lot of mints?
Every once in a while to keep my breath fresh, but not too often.
Because remember we talked about that too much sugar is not good for your teeth, right?
Yeah, but you gotta have the good breath too, right?
Oh, that's true. Okay, well that's good. I think you probably are having root sensitivity. It's not a big problem. But I'll have to have a closer look, okay?
Okay, sounds
Okay,
good.
that's good.
Well, that visit went very well. Although I hope that he's eating sugar-free mints.
Yes, I guess fresh breath is important. But you can tell that this patient, the one in the second example, is actually taking his dental health care quite seriously.
Right.
He comes across as somebody who's fairly responsible.
Right. And that helps a lot because often we think that we're taking good care of our teeth, go to see the dentist, and expect the dentist to fix all of our problems.
And as was made clear from the first example, the dentist can only do so much. If you're only going in when you have a problem, that's not the best care. It's all the stuff that happens between the dental visits that's quite important.
That's right. Especially what happens in the home with brushing and flossing. Now, those were a lot of points that Dr. Katz mentioned. How do we remember all those and keep them straight?
Well, I can sort of summarize them as 5 main points. Dr. Katz emphasized that brushing your teeth regularly is very important. So ideally brush your teeth at least twice a day, so once in the morning and once in the evening. And if possible, brush after meals throughout the day. That's not always easy. People are at school, you're at work, it's not easy, but as often as you can. Right. The second really important message that he gave was about flossing your teeth. Flossing it's a slow process. It's not something you can kind of do quickly. But it's all those areas in between the teeth that are really hard to get to. And if you don't floss your teeth, then you can get all sorts of gum and tooth damage, is what Dr. Katz was talking about. The third issue was around regular visits to the dentist, and we sort of talked about that already. You can't go to the dentist when you just have a problem. You should be seeing the dentist. From what I understood from Dr. Katz's words, is that you should be seeing the dentist at least once every 6 months. And it sounds like at a regular visit, what they're doing is they'll do a cleaning. Because even with regular brushing your teeth and flossing, there's areas in there that you just can't get to. And the dental hygienist or the dentist can get into those deep spots and clean those areas out. Often they'll do x-rays to make sure there aren't problems deeper down. And if there are problems, you've caught them early enough. So I would say what Dr. Katz says makes sense. See the dentist at least once every 6 months, and maybe even more often.
Right.
The other point he made was about kids, and I asked him, how often should little kids go in? A lot of us feel that baby teeth aren't that important because they're going to be replaced with adult teeth. But Dr. Katz made a really good point about that the baby teeth hold a space for the adult teeth. So if the baby teeth aren't very healthy, it can also mess up the adult teeth that come in later, or diseases can be passed forward. And the other thing he didn't say, and I think is important, especially when I think about my kids and the young kids in my practice, your baby teeth stay with you a good number of years. So if you're thinking about pictures and how your child interacts in the community, it's a big issue what the teeth look like, even though they're just baby teeth.
Right.
Right. The other thing that Dr. Katz talked about was the kind of foods to avoid. I mean, generally we know that candy's bad for you, sweet foods are bad for you, but I never thought about it as sweet, sticky food. So any food that's sweet and sticky, you get sort of a double whammy. So it's sweet, and the sugar leads to things like infections and cavities. But the sticky foods are hard because then the stuff is hard to clean out, hard to get out of there. So those would be sort of the main pearls I think Dr. Katz wanted to share with us.
Thank you, Gurdeep. Those were very valuable tips that Dr. Katz shared with us and that you were able to summarize. I hope that you also have learned some tips on how to better take care of your teeth and generally about oral hygiene.
If you have any feedback or comments about today's episode or any other episodes, please do give them to us. We're really keen on knowing what you think about these episodes and what you would like to see in future episodes. So please go to our webpage, www.pearlsforsuccess.com, and give us your feedback.
We hope that you can join us next week for another episode of Pearls for Success to help both you and your family.